not a teenager. Although sometimes she thinks I act like one. These are all true. But I remember when I was a teenager a few years ago, and some of the struggles and challenges that I experienced that may be similar to what some of you may have experienced in your lives. I grew up in a small rural New England village, pretty small. When I entered age 13, I began to experience a lot of challenges in my life. In the summer of my 13th year, one of my parents, who was suffering from severe depression, committed suicide. That presented significant challenges for me at the time. When I entered the high school, it was a very small school. There were 60 people in the high school, 12 in my freshman class, very small. Everybody knew everybody else's business. There were no secrets in that town. There certainly were no secrets in that school. But no one talked with me about my experience. None of the teachers. There were 4 teachers, and there was no guidance counselor or therapist in the school system. So I struggled through the first couple of years, quietly dealing with the grief that I was experiencing from that event. 2 years later, my father brought home a new wife. She was a woman that had been living in a larger city, not far from where we lived. And along with this new wife, he brought 6 more children. So we grew to a family of 11 overnight. That presented some challenges too. I was the second oldest. So I had to take a lot of time serving as a pseudo parent, if you will. Shortly after that, in this small village, the gossip was increasing about the new marriage, new children. And so my father said, "We're moving." So he packed us all up in a yellow school bus that he had purchased. And we drove all the way from Maine to San Diego. This in the mid-1960s. So it was like, for me, entering a brand new world. A different culture in the 60s in Southern California than in rural Maine. I attended a school there, a high school, with 2,600 students going from a school in a class of 12. Again, some cultural shock for me, in a sense, from that transition. Shortly after we arrived, within 6 months or so, my then stepmother decided that she didn't like me. So she picked up her 6 children and she moved back to Maine. My father and I and my younger brother remained there in Southern California until I graduated from high school. When I graduated from high school, I looked around and said, now what do I do? I don't have any friends that I've developed here. I don't have a planned future. College wasn't something that I even considered. So I entered the military during the height of the Vietnam War at age 18. Another stressor in my life, another challenge in my life. So these experiences, I think, affected me then and has affected me throughout my life, as well as currently. They impact who I am, how I act, what I do. It's not just one experience that changes life. So I've worked in the field of mental health. Well, this keeps going, and I wasn't ready to do that, so I'm going to back up. So I entered the mental health field in the fall of 1973, a couple of years ago. And I've worked in that field until I retired recently post-COVID. I worked and volunteered in a number of different organizations and agencies, including working in a group home for behaviorally disturbed adolescents who are unable to remain at home. So I got an experience with that. I also volunteered at a local school for teens with autism and working with them, as well as providing some guidance with their families. For the next several years, I worked in a variety of homes, group homes, community facilities that primarily focused on young adults and teens. After several years, I decided I wanted to work in an academic setting. So I was employed at a university for 10 years, teaching rehabilitation providers with counseling skills. After about 10 years, I got tired of doing that. The academic setting wasn't something that I found particularly satisfying, or I didn't think it was particularly useful. And so I returned to direct service. My first job was working in a university counseling center after that, where I worked at a local university here in the Portland area, counseling students who are having difficulties. I'll be talking a little bit later about one young Asian freshman student, and the kinds of difficulties that she experienced and what we were able to do to help her. As mentioned in the handout that you saw, I also worked for a time at Columbia River Mental Health here in Vancouver. I had this 9 to 5 job, 9 at night till 5 in the morning, working at the local crisis center, where I would take calls from people in crisis, often from teenagers. One of the parts of that working at Columbia River was, because of my background and experience, they asked me to get certified and trained as a comprehensive mental health provider, what's called a CDMHP. It's a legal status here in Washington State, where I was responsible for conducting face-to-face evaluations at the local emergency room when it was now Peace Health. I did that for about 18 months. And during that time, I did over 300 face-to-face evaluations for adults and students and teens who were coming in because they were in mental health crisis, often because they had made some sort of suicide attempt. That was certainly some long nights. Some days I would do up to 5 or 6 evaluations in one evening. Often, because of my decisions based upon that, I would have to have people locked in a psychiatric unit for at least 72 hours whole until they were better evaluated. I also worked in Portland in a psychiatric facility for teenagers in a locked unit who have been placed there because of some significant and severe mental health issues. So I try to bring to you today some personal history to be able to talk about mental health crises and prevention related to Asian American teens. So one of the most serious results of mental health crisis is the #1 cause of death for Asian American youth between ages 14 and 24. The statistics show that the current suicide rate among this group is about 9 deaths per 100,000 individuals. If you look at non-Asian Americans, the rate is slightly higher at about 11 per 100,000. When I looked at the data over the past decade related to Asian American teens in this age group, I saw that there's been a 61% increase in suicide attempts by Asian American teens. And even more concerning is a 64% increase in Asian American females. So what are the causes? What are the precipitating factors related to a teen being able to feel like they're in a position where the only solution they see is to end their life? So I want to talk about some of the potential causes and risk factors specifically related to Asian American teens. We know that there is a very high rate of depression and anxiety among Asian American teens. The latest data that I saw is 30% of Asian American teens report symptoms of depression. A significant number, a third of teens. Anxiety disorders are also present, with social anxiety being one of the more prominent ones affecting Asian American teens, in part due to cultural pressures and expectations, particularly expectations around how they should behave, about their academic performances. So one of the biggest issues that plays a role in all of that is stigma associated with culture of Asian Americans around mental health. Just like when I was growing up, there was a stigma in my small New England community about talking about being involved in admitting to any type of mental health, let alone suicide. That's also prevalent in Asian American families. We see certain dynamics around high expectations of academic pressure from parents. I spoke earlier with a friend who has just arrived from Chongqing, and he told me that that type of pressure is also prevalent in his city and home. So it's not something that's specifically associated with Asian Americans, but it is part of the culture of Asians that drive to succeed, that drive to perform well. These pressures can lead to things such as stress, anxiety, feelings of inadequacy, I'm just not good enough, all contributing to mental health struggles. Is this microphone bothering you with the breathing?
No,
Is it okay?
that's fine.
All right.
That's okay.
There's also the presence of factors such as what intergenerational conflicts, particularly between families, parents that were born in Asian country and immigrate here to the US, and their children are American born, raised in this culture, and that's different than the culture that you were raised in, or the parent was raised in. And that can lead to lots of communication problems, lots of barriers, and pressures and expectation about how the teenager is supposed to perform. These conflicts often surround issues such as identity, autonomy, adherence to traditional values. All of these can exacerbate stress and emotional distress. In the United States, there is this myth about Asians, and it's known as the model minority. Some of you may have heard that term before. It places a lot of unrealistic expectations on Asian Americans, that they're expected to succeed in academics, succeed in jobs, succeed in life. So that puts a lot of pressure on them. We also see, as someone mentioned to me earlier, examples of racism and discrimination, particularly in schools, but also in the community. Some of you may have experienced some of that in your own personal life here, coming here to the United States. Another important factor that plays a role in risk is the availability of means, such as firearms or other kinds of self-harm. So that availability increases risk. It increases risk for any family. Research indicates that the most common methods of suicide among Asian American youths in this age group of 15 to 24 include suffocation, firearms, and poisoning. While suffocation continues to be the most prevalent method, the use of firearms has been increasing. So one of the important things around that is education of family members, making sure that if you have firearms in the home, that you secure them properly to ensure that they're not used that results in some sort of family tragedy. So now I want to talk about signs and symptoms. Why is that important? Because some people may not be aware of the common signs that lead to depression, anxiety, and possibly eventually suicide ideation and even suicide attempts. So I wanted to show you these things, and then as you deal with a peer, with a family member, you become more aware of the potential signs that you need to be aware of and intervene when it seems appropriate. I'm going backwards. So first I want to talk about behavioral changes. What kinds of changes might occur that would alert you to some problems? Now, I want you to remember that these are changes from how they normally act, how they normally behave. So in some cases, withdrawal from isolation from family members, from friends, and from social activities. They just spend their time in their room. They don't go out anymore. They don't interact with anyone anymore. There may be a loss of interest. They no longer enjoy activities that they once loved doing. When you ask them to go to a movie or ask them to go to some sort of event, they say, "No, I really don't want to, I'm too tired, or I'm no longer interested, or it's not fun anymore." The formal psychological term for this is called anhedonia. There may also be changes in sleep patterns. So sleeping excessively, a change from their normal behavior, or not sleeping hardly at all. There may also be signs or reports of
Recording in progress.
signs signs of frequent nights. We'll wait just a moment till that gets fitted here. Okay. We may also see changes in eating habits. Eating too much or not eating at all. When they eat too much, it's a way for them to seek comfort, to sort of have a Band-Aid on their feelings of depression or feelings of anxiety. Or if they can't eat at all, you see a dramatic weight loss. There may also be, as you might imagine, some declines in their academic work despite the pressures on them. Or if they're working, there may be changes in their work performance, sudden drop in grades, work productivity, or frequent absences from either school or their place of employment. So these are some of the behavioral changes that you might be alerted to as you look at a family member that might cause you some concern. There are also emotional signs, expressions of hopelessness. You may be saying statements like, "Yeah, I can't do anything right now. I'll never get ahead. There's really no point in me trying. I'm just too stupid to figure this out, to do this homework." There may be the presence of extreme mood swings, such as rapid changes in their mood. One minute they're extremely sad, and then there's this sudden calmness and maybe even happiness. For me, that's one of the signs that can mark they've made a decision about what they're going to do. If all of a sudden they're sad and then they come up with a solution, what they're going to do, meaning they may make some sort of suicide attempt, that's a concern. In some cases, there may be signs of persistent sadness, depression, ongoing feelings of sadness, generally a feeling of emptiness, and sometimes irritability. I tend to see more irritability with male teens than I do with females. There may be signs of increased anxiety or agitation, heightened levels of worry. They're worried all the time about how they're going to get their homework done, how they're going to get a certain grade, how they're going to accomplish some things. There may be fears of I can't go do this. I just will fail, so I'm not going to go to school, or I'm not going to try this. But there may be just general restlessness. They just can't sit still. They're not able to engage in what is known as self-soothing, relaxing themselves. You may start to see some physical symptoms. Some people who are suffering from anxiety and depression, when it's not acceptable to communicate those emotional distress, they tend to convert that into physical symptoms. So it may be headaches, stomach aches, or other unexplained symptoms. They've seen the physician can't find any medical reason for these symptoms. It may be a sense of converting emotional distress into physical symptoms. There may be changes in their personal appearance. They're no longer paying attention to their personal grooming, personal hygiene, the way that they dress. That's a change from what they normally do. Those are some indications of physical symptoms that may be present. There may be changes in their communication. They may talk about death or suicide, mentioning dying, even if sometimes it seems casual or even joking about it. It's some way for them to express themselves that may be a bit more acceptable than just telling you how they're really feeling. There may be expressions of despair, certain writings that they make, drawings that talk about themes of death. I worked with one young lady that was often doodling or drawing, and they were always these dark images about death. That was how she expressed some of her despair about what was going on in her life. In some circumstances, there may be indications of saying goodbye to you or goodbye to friends. Not in a just, hey, see you later kind of way, but something that seems more serious, as if you imagine that they're saying goodbye for the last time. Another indication that I've seen quite a bit with depressed people who are thinking about suicide is they give away their prized possessions. They want to have other people have them because they've made a decision to end their lives. In some cases, you may see handwritten informal wills that they put in a journal, they put in a piece of paper in their drawer, and it says, gee, when I'm gone, I want this to go to my brother, this to go to my friend at school, etc. So again, that's another indication of some communications and expressions that surface red flags for you. We may also see certain kinds of risky behaviors. It's not very common among Asian American teens in terms of substance abuse, like increased use of alcohol or drugs or other substances compared to the general teen population. But it may be, if it is occurring, it may be a concern that you want to pay attention to. They may be engaging in things involving self-harm, engaging in self-injurious behaviors, such as cutting or burning. What the heck does that mean? I worked with several people that were cutting their wrists, making small marks on their wrists. And then they would wear long sleeve shirts in the summer to keep people from seeing that this was one thing. Or when they didn't do it to their wrists, they were cutting inside their thigh. In some cases, particularly among boys, they were burning themselves with a cigarette. I thought, when I started seeing that early in my career, I started to ask them, what is that for? Why are you doing that? And the response I almost uniformly receive from them is the physical pain drowns out the emotional pain. It's a way for them to cope with and deal with the emotional pain. It wasn't a true suicide attempt. It was a way of signaling that I'm in pain. And I can't say that to you directly. I can't express it. So you should be aware of that kind of behavior if you're seeing it. We'll talk about one young lady that I worked with that was engaging in that kind of behavior in a little bit. So all of these factors can contribute. Sometimes it's just one or two, sometimes it's a group of them, or sometimes it's tiered. They start with some things and it increases. It's important that these are changes in behaviors from how they normally have been prior to these changes. So comparing those is important. So what are some prevention strategies? How can you minimize this problem, minimize the circumstance where our teens may be experiencing distress and have no solutions or no ideas to help manage it? one of the things that's preventive in nature is a positive family relationship, encouraging a supportive and open family environment. Sometimes that doesn't always occur. Everybody's busy in their lives. They don't always have time to take a moment to do that, or they're overly critical about their team's performance as opposed to being more supportive. The ability to create a safe space for teens to be able to express their feelings and to seek help within a family setting is important. Otherwise, you may end up with something that you weren't even aware of. I also know that cultural identity and pride, proving that, connecting with that, is another preventive factor. So it enhances self-esteem, gives them a strong sense of cultural identity, and it can boost their overall resilience, their psychological resilience to kinds of stressors. So being able to engage with family members or with peers in cultural practices that connect them with heritage through these cultural practices. So that may be being involved in the association, being involved in other types of activities that are of a cultural nature. Accessing or being able to access mental health resources. And I make a point of this that not all mental health resources are appropriate. Not all mental health resources are competent to deal with these kinds of issues. So knowing what available community resources are that are based upon culturally competent therapists is important. So seeking out, accessing professionals in the community who can provide appropriate care. And we'll talk about in a few minutes about how you can do that if you're not already aware of some of them. In the community, there are a variety of different types of therapists. There are psychologists with a PhD. There are psychiatrists with an MD degree that provide medications and sometimes counseling. There are also master's level therapists, including masters of social work. So finding someone that fits you or fits your team is important. The median contact with a therapist is one session, and they never come back. And that's often because there's not a good connection between the therapist and the client. So it's important that you research out, identify appropriate resources in the community that can meet that need. Peer support. That means other teens that share the same kinds of concerns, the same kinds of problems in a group setting. Now that may be a peer support group that provides emotional support to reduce feelings of isolation. I'm not the only person that's feeling this way. I'm not the only person that's dealing with these issues. So going to a peer support group, either formally or informally, sometimes you find those in the community, sometimes you find them in schools, and sometimes you find them in group counselors. So looking for and identifying the possibility of peer support groups may be another alternative than individual. It may be also important that parents who are stressed about going and about dealing with their child can meet in their own peer support group so that they can share the struggles that they're having and know that they're not the only parent with these kinds of challenges. Sometimes being involved in school or community activities, such as certain select school clubs, sports, or community organizations, because they foster a sense of belonging. They feel a purpose through this positive social interactions. They don't feel or experience racism or discrimination. They're accepted and supported. So looking for certain kinds of activities in the community that will help that child or that person connect with other people in a positive way. Also, I want to talk about the presence of positive role models. What the heck does that mean? It means having someone in their life, in their community, that can offer them support, can offer them guidance, and serve as a role model for dealing with mental health types of issues and concerns and challenges. And that may be a teacher at school, it may be a guidance counselor, it may be a youth pastor in your local church, or it could be someone locally in a community organization. But trying to connect them with some positive role models may also help them deal informally with some of the issues and challenges, because it may be too uncomfortable, too scary, if you will, to go into a counseling session with someone they're not comfortable with or someone they don't necessarily know. There are some other kinds of healthy coping mechanisms that help build psychological resilience. So one of the things that I often work with is teaching people mindfulness. If you're not familiar with that term, it might be important to learn what that's about. I may teach them meditation, certain kinds of breathing techniques that help them to calm themselves down. When they find themselves in some stressful situation, they remember to breathe, and to breathe in a certain way that lowers their anxiety level, lowers their heart rate. There may also be opportunities to encourage them to engage in creative activities that help manage their stress. Activities that they enjoy either by themselves or with the family or with peers in the local community. Whatever that happens to be, whether it's art or photography or at a local chess club, some sort of activities that give them an opportunity to manage some of their stress and emotions, and also to develop positive social interactions with others. So I want to talk a little bit about broader prevention strategies. So one of them is promoting mental health awareness in the community, which will help reduce stigmas because people can talk about it, people can learn about it. So having educational campaigns, maybe something as simple as a brief talk like this today, are an opportunity to have open dialogue about these issues. Teaching people about early intervention signs so that they recognize those signs and can access resources in the community to address it. It may also be important to work on strengthening family support. I told you before, I mentioned before, that family support is one of the most significant strategies for prevention or protection to experiencing mental health crisis. So that might mean setting up family counseling, so that every family member is comfortable in having that dialogue, and a therapist can help facilitate that in a positive interactions way. Schools maybe have programs present that deal with things such as individual counseling or peer support groups. And if your school doesn't have those resources, it may be up to you to advocate for that so that it's available for your child, your teen in the community. Helping to establish other kinds of peer support groups, maybe in the school, maybe in a local association. Because if it's not available, then maybe you need to start one that will be helpful. It also might involve setting up what's known as a peer mentorship program. I worked in a peer mentorship program several years ago, where I would be paired with a young teen. It was the Girls and Boys Society. And I would visit with this teen once a week, and we'd do activities together that were positive. Sometimes they would disclose information to me, and I could give them guidance, but they were always watching me, seeing how I reacted to circumstances and difficulties. Also highlighting positive role models in the community that can inspire, encourage teens to seek help and to build resilience. So what are some of the, so these are some of the protective factors, some of the things that can be implemented that will help reduce the risk for mental health crises. Let's talk about some resources. There are some resources nationally and locally that I'll talk about. One of them is the Asian American Psychological Association. This is a national organization under the purview of the American Psychological Association, and they provide guidance, they provide referral information, they also provide resources. You can access them on the internet. Just type in Asian American Psychological Associations in Google. It'll take you to their website. You can look through all the documents and educational information that they have. Sometimes they'll do presentations for other professionals, and sometimes they'll do that for parents or even teens. So that's something to look out for. There's also the National Asian American Pacific Islander Mental Health Association. There's a long term there that you see. And the Asian Mental Health Collective. That's a Facebook group that people can join and seek information. We also know there's the presence of crisis lines.
Would you go back? I didn't write down everything.
Okay.
Previous slide.
Okay.
Yeah, thank you. Just give me a second.
I'll just answer.
We'll post it on our website. We'll post it on our website later. Yeah,
It's called the Asian Mental Health Collective. Okay. So I think if you do a Facebook search for that, you may be able to locate it.
There's a local NAMI.
Yes, we're going to talk about NAMI.
Yeah, Vancouver has one, but it's not Asian. It's just for everybody.
Right. It's for mental health.
Yes.
Right.
Thank you.
Yep. Let's talk a moment about crisis lines. There are phone lines available to call. And there are also now text lines to call, and even a chat website to deal with mental health crises. We're also certainly aware of 911 to call in the event of life-threatening emergencies. And in some communities, not here in Vancouver that I'm aware of, but in Portland, there are some mobile crisis units that can come to the location, to the home, to the bridge, wherever the crisis is occurring. So here's some resources There's a teen line that's specifically designed for teenagers that unfortunately is only available between 6 and 10 p.m. Pacific Standard Time. They also have a text resource that's available between 6 p.m. and 9 p.m. Recently, there's been a lot of media attention to this new crisis line called 988. Instead of calling 911, when you have a mental health crisis and you need to talk with someone, you dial 988. You can call or text to that line 24 hours a day, 7 days a week. And that's not just for teens in crisis, it's for anyone in crisis. It's for parents who are dealing with a teen in crisis and what can they do? And also there's a chat line. So if people are not comfortable texting or calling, they can go to this chat line, 988lifeline.org, and communicate that way in a real-time contact with a mental health professional. There's also another crisis text line. I've not used this one, MHA. You text MHA to this 741-741, and that's available 24/7. Okay, I'm going to go on to the next slide. In Washington and Oregon, there's not, there are some Asian counseling services in Seattle, 2 of them, in fact, but nothing here locally that I'm aware of. You may be aware of a counseling service that's specifically for Asians in Vancouver, but I'm not able to locate that. And I've only been able to locate one psychologist who's Asian here in the Vancouver area. However, when you can contact these counseling services, they often do telehealth. So they can do FaceTime with a teen, even from Seattle, provide individual crisis counseling or individual counseling. Yes.
Do you think telehealth is as effective as face-to-face counseling?
I personally don't, but I'm old school. But some people are comfortable with it. Yes.
Yeah, I took a communication class during my MBA program, and it says for communication, 70% of the message is in nonverbal. So it's your facial expression, your body language, and the tone of your voice, and you lose most of those during the Zoom meeting.
That's correct.
Yeah.
And I just want to express my opinion. We did some of the counseling during COVID and then over Zoom, and that was no choice, and that was not effective.
Right. But if you have no other alternative and you want to speak with someone who's culturally competent, that may be a resource, or you may talk with the Asian Counseling Service and they may know of a person in the Vancouver or Greater Portland area that they know is culturally competent, and they can perhaps refer that to you. Yes.
And also, with all due respect, doctors are not God. So they carry their personal. I'm sorry.
Oh.
I'd like to call you God, but yeah, I'm thank you for coming here. But because all the counselors, therapists, may have various training and also carry their personal baggage, because a lot of therapists come to their profession, like you, may have personal experience or try to self-diagnose or self-treat. So they have their own baggage themselves, and they may seek counseling as well while they're doing your counseling.
Exactly.
And just for example, like if your counselor is divorced and successful, when you counsel in marriage relationship with your counselor, she might influence you towards divorce, while you may not want a divorce and seeking a compromise, especially Chinese, right? So just be aware, your doctor is not God.
Yeah. So
and they may screw up you.
Right.
Sorry.
So the important point about that is know and check out the therapist. There's online reviews. You can talk with other people in the community that have had perhaps experiences with that therapist and know whether or not they're positive or not. And then again, if you go to a session and it doesn't feel right, doesn't feel comfortable, it's not a good connection, then don't return. Seek someone else out.
One more thing. Sorry.
Yes, go ahead.
Because the reason I was compelled to come here is in this community, there's 2 suicides happened before this young person.
Mhm.
And I am directly kind of know them, and I wish I would do something to prevent from it happen. And I could do something. I didn't. I mean, I couldn't. I could, but I couldn't.
Mhm.
So I'd like to share that with the community so we can be aware. And my personal experience with a bad doctor is a near-death experience as well. So I'm here to tell everybody there's bad doctors. Even you treat, if you seek help, you may not get what you want. I mean, sorry, you are a good one, obviously.
Yes,
I found it really challenging to find any available counselors. I can tell you, like, when we're trying to look for counselors when we move here, we call every single counselor
Mhm.
in the area, and then we found one that's 40 minutes of drive away in Portland, and then we counseled once, and that was not a good fit, and then that's it. There's no more. We're on the wait list for everything, but 2 years later, I haven't. So it's that, like, I'm not even looking for cultural competence. I'm looking for any.
yeah, I think since the pandemic, I've seen an uptick in counselors being in the community. There's a lot of online counseling going on. And also people are more readily seeking out counselors. And so there's often a waiting list.
Yeah, and first of all, you can put yourself on
Fresh
waiting list,
initiative.
maybe on multiple waiting list, and that's
Well,
first. And the second,
And
I don't know if it's the Chinese thing. I think with Chinese people, the culture might very much trust authority. Like people from Yale, they think may have a. I mean, I'm not saying you, but in general. So
Excuse me, we will have a Q&A time in the end of the presentation, okay? So if there is some immediate question, we can wait until the Q&A question. Okay, thank you. Yeah, I like the heat conversation, but I just want to.
we'll have an opportunity. There's just a little bit more and then we'll have an opportunity for Q&As or
Yeah.
other comments.
Sure.
So at Oregon Health Science University, there's the Intercultural Psychiatric Program. It's medical model driven. They deal with people from all kinds of different cultures, not just Asian cultures. So it's possible to contact them and see if there's a potential referral from them or services from them. I've used it one time for a person that was from Somalia.
Oh,
There's also a website at Oregon Health Science University that provides Portland mental health resources. You could certainly check that out. There's an Asian Health and Service Center. I don't know if you contacted them, but they have phone contact numbers. And so if your only language or your primary language is Mandarin or Cantonese or some other Asian language, you can talk with someone in that particular language. Someone also mentioned NAMI. That's a branch here in Vancouver. There are some groups, online groups on Reddit, if you're familiar with that platform, as well as Facebook groups.
Which group?
Reddit.
Which, I know Reddit, which subgroup?
Uh,
I know Reddit.
I'll look that up in just a moment, okay? I don't have that right in front of me on the slide, okay? There are also some books that you might consider exploring or reading. So there's Asian American Mental Health, A Guide to Recovery, Parenting Asian Teens, A Practical Guide to Understanding and Nurturing Your Child, For the Power to Prevent Suicide, A Guide for Teens, Helping Teens at Peer Support. So those are three potential books that might be available in the library, you can certainly find them on through Amazon. So I'm going to talk with you a little bit about 3 case studies. So these are people that I worked with in the past. I've changed the names and some of the circumstances to certainly protect their confidentiality. So I'm going to talk about Emily. Emily was a 17-year-old girl who was enrolled as a freshman in a local university here in the Portland area. She came with high expectations from her parents, particularly her father. During her first semester in college, she began displaying a lot of anxiety because she couldn't do the work, or felt that she couldn't do the work. She started failing. She was referred by one of her professors to see me at a counseling center, student counseling center. I had the opportunity only to work with her about 3 sessions. And then she was taking a midterm and her anxiety increased significantly because she wasn't able to do it successfully. She started engaging in a lot of cutting behaviors. She was seeing a psychiatric nurse practitioner for some medication. When father learned of this recent episode of cutting behavior, he got on the plane and he flew here from out of state, and he decided that he was going to take his daughter out of the school. He was angry at the school and he was angry at me because I hadn't solved the situation in 3 counseling sessions. He took her home, but fortunately I was able to connect with a culturally competent therapist in her local community. And I was also able to set her up with some peer group resources in her local community. This was helpful for her. She felt much more supported. She began taking classes at a local community college where the academics were not quite so demanding. And over the 2-year period that she was in the community college program, she was beginning to develop some success in her academic work. And then she was eventually able to transition to a 4-year university. But it was that initial push, far away from home, without any support systems, without any friends in this new college, that she struggled quite a bit. I also worked with a young man that I'll call Jason. He was experiencing, he's Asian American. He was experiencing a lot of bullying and discrimination in his school. I think he was 15 years old, and he was experiencing a lot of this bullying. His parents were unaware of this. He just kind of didn't want to tell anybody about it. It got to the point where he attempted suicide. He was taken to the local emergency room. I saw him there, did an assessment, and I was able to connect him to a local resource. And also, I was able to connect the family to family counseling so that they would become more aware of what was going on with their son and how they could be more observant or supportive and help him when he encountered this type of bullying and discrimination. I also met with a counselor at the school and some administrators to be aware of the fact that this was going on so that they could do an educational program for the students relative to this kind of behavior. And you're well aware of bullying behaviors going on in schools all the time, not just with Asian Americans, but with other students that are perceived as weaker, if you will, or easy to bully. And the third person that I want to talk about is May. May was 15 or 16, and she was having some difficulties with her parents and a grandparent that lived in the home. And they had big expectations about her academic performance. and how she was supposed to deal with any stressors in her life. She was not able to cope very adequately. We were able to set up a mental health awareness program for her family and some family counseling, along with hooking her up with a culturally competent therapist in the community that she was living in. So these are all examples of experiences where there's different dynamics going on that affect a teen's ability to deal with mental health crisis, mental health problems that they're experiencing. So that's the brief overview to begin for you to start thinking about these issues, particularly if they're something that you're concerned about in your family. And so now would be an appropriate time if people have questions or comments or know of other resources. Yes, ma'am.
Yeah, so just ask
It's
this.
Jenny, right?
Yes, so just to answer this lady's question about finding doctors, from my experiences, during COVID times, my daughter refused to go to school, basically. So I was trying to find a therapist, and which is very difficult because most of them are online, and she refused to go to any online therapist. So what I did is just to open, do not ask your insurance to refer you, just open to pay out of your pocket. And then I did find the one, but she's actually not suitable. She is, that's one of the reasons she opened up to face-to-face, because she wants to establish her own practice. And after COVID, she was getting too many patients, like back to back with no
time in.
Yeah, and after 6 months check mark, I was asking her, what did you learn from my daughter? She couldn't answer any questions. Like, who is her friend? What is her challenge? She just generally speaking say, oh, high school kids had this. But what specifically? So she's kind of, just there for the money. So just
Perhaps.
perhaps.
Remember also that if I'm working with a teen, I establish confidentiality parameters with the teen and with the parent, so that the teen will feel comfortable disclosing information to me, knowing that I'm not going to turn around and tell the parent.
Yeah.
So that may be going on. I don't know about your individual circumstances.
That's not the intent, because we never asked her any information. We are just asking in general, what is her friend and etc. And just to address this question, one more thing. So later on, when I was searching for another therapist, I actually found one. She's a trainee. She does not even have a license because she was in the internship. But however, she's a perfect match because she has Chinese heritage. She's a half, cross-racial marriage, and also both her parents divorced and married to their own race. So they have joint custody. So she's very familiar with, she's from dad is from Taiwan, so she knows that, and she also knows the white culture. I'm sorry, it's not practical correct, but like my daughter goes to campus high school where there is 10% Asian. So her struggle pretty much has lots of culture issue, and she was able to address that perfectly. And they share the same passion of anime. So it's perfect chemistry, even she does not have a license there yet, but she's under supervision. So you can just open your, if you are willing to not to find a Yale graduate, then you probably will be easy to get a therapist.
There is some universities that have their own counseling center as a training center for supervisors that are training for new graduates who are supervised by licensed psychologists. There's one in downtown Portland that's affiliated with Pacific University. I think George Fox may also have some program, and the fees for those are often minimal. I worked there in the downtown area, and I would see patients for $1 an hour.
Okay, so I don't know which school your kids go to. I'm a parent, so I'm eager to share. I'm a mom too. So, like my kids my daughter goes to, she is in college now, but she went to Campus High.
Mhm.
And in Campus High, they have different psychologists, actually multiple, assigned to each alphabetical of your last name.
Mhm.
So you can connect with them and they can schedule your appointment right away. And also, like, even my son goes to Odyssey, they have a psychologist at the school as well, even elementary school. I mean, my kids are troubling kids, so they, like, even like at Pronto Elementary School, they have a counselor, Mr. Durfee, so who is excellent. And those are your first stop to do it, and then there's pediatrician. And if you do not like those sources, you can always look by yourself on Psychology Today.
Okay.
There's tons of therapists.
There's a website, Psychology Today,
Yes.
but it only shows one psychologist in Vancouver that's Asian, and her fee is $325 an hour. I thought that was rather exorbitant. Question in the back or comment?
So I think for many of the families, before we look for counseling services, perhaps we all want to know as parents, what can we do to build that trust, to bridge the gap with our children? And so we can have open communications, so the parents can help. However, I know that our children know us. They have formed their opinions about us parents as they grow up with us. So it becomes extremely difficult. And also they have the reasons to not talk to us as they turn into teenagers and young adults. Because, for example, they probably know how we will react and how we will respond when they either make a request or ask a question or just not say anything. So what can we do?
So one of the things that when I encountered that kind of circumstance, I would have the family go to family counseling. And that way there's a person in the room that serves as a guide or a run interference, if you will, between parents and children, so that each person in the room gets an opportunity to say things and to confront or disagree with people in a safe environment. So it's teaching the parents and the child how to communicate effectively. And so you're right, there's often those types of dynamics in the family that are hard to break. And the only way I've found to be able to do that is to have them engage in family counseling.
So then I have a follow-up question. We know that teenagers and young adults, they usually have strong emotions. They trust their peers more than us.
Yeah.
How do we as parents convince them to join us for family counseling services?
I don't think it's easy to do that, obviously, particularly with a teen who's resistant to that. Sometimes it requires guiding the teen to come with you. The family needs some counseling. Mom and dad are going. We like you and brother to come along with us to help us. So they don't see it as the focus of them solely, but it's the focus of, gee, parents want to be better parents in communicating with their child. But again, it's quite a challenge, particularly for teenagers, I know.
So can I help speak of experience? So what I did is to have my daughter to talk with that therapist first, and when they establish the relationship, I then talk with the therapist separately in different sessions, and then we have a joint counseling. But it's very difficult. I mean, it was so again, bad therapists can screw up your situation at all. They will be on your kid's side completely, or on your side completely, depending on age differences. Because I'm Gen X, my kids are Gen Z. I mean, we don't have any connections and internet 5 years in one generation. So how many generations apart? Not AI is 2 years, one generation. So think of how I connect with my parents. Like my parents in Shanghai, because we even have I've been here for over 30 years. And that was before internet age, right? So have different opinions and view of the world with your kids is natural. I consider the most success of parenting is to be a friend with your adult children. And I'm still striving on that, and I'm very aware of that. So it's a tall order for you to meet. Do not feel frustrated because it is a journey to get there.
That's definitely very good.
So one comment about my practice is I would not meet with the child and the family. I would keep that separate. I would meet with the child, and that's my focus. If there's to be family counseling, I would refer that out. The same with marital couples, and they're having marital discord. I don't see both of them. I see one and have them see a marital counselor separately so that I'm focused on the needs of my individual client. Some people trained in family therapy, and some people trained in couples counseling will look at the group, the system, if you will. But my preference was one-on-one.
And just speak experience again, because the marriage counseling, if you do it, and the two of you are there.
I'm sorry, I think we need to let the.
Okay, sorry.
Yeah,
Yes,
me too.
A question, like how do we understand the kids and their like frustration and their mental health growth during teen? Because one thing is my little one, he was in kindergarten. I brought him to buy a lunchbox, and when he chose, I thought like it's not functional. But he insists. I'm glad I let him choose. And then when I volunteer at school, I saw the whole class, everyone have exactly same lunchbox. So this experience really shocked me. Like, oh, the kids think something totally different from adults. So how do we understand the kids in the teens? Like, oh, we know they want to be exactly same as others. So we can introduce them like everyone is different. Everyone has their own weakness and strengths. So I would like to get some resource about like how teens' mental health grows.
Anybody have a suggestion?
Why don't they just let them use the lunchbox? What's the big deal? Like,
No, because the things we thought like a little.
But you didn't understand. You didn't understand in school that everybody wanted to belong with the same lunchbox. So that was something that you didn't understand, and maybe allowing that child to choose their own lunchbox and to experience the consequences of that. If it's faulty, if it's broken, they made the choice, they have to deal with the consequences. Just like you and I in our life, when we make bad choices, no one comes to rescue us. We have to deal with the consequences. Yes.
Why the kids don't tell you the reason? Because they want to choose this lunchbox because they want to be the same with others. But why
that's the thing, like adult and youth, the communication. How do we build a channel? We understand them and they understand parents, and then we can say, okay, I agree with you or I don't agree with you, but I respect you. That's the point. I do not mean lunchbox.
So one way of doing that is modeling appropriate behavior in the family. So maybe you and your husband or partner has a disagreement. Don't necessarily go into the bedroom and have your disagreement there quietly, but sometimes when it's appropriate, have that disagreement at the kitchen table to model for that child how they deal with these circumstances, and they can follow you, see what you're doing, and then they see, well, it's okay to disagree. It's okay to tell you things because mom and dad do it, and that means it's okay because they're looking to you as models, just like they look to teachers in school, their coach, or even some of their peers. So sometimes it's just learning how to model that behavior that can be helpful.
Or you just ask them questions, be like, why'd you make that choice?
Yeah.
You ask for a reason, and it doesn't mean, you know, you can stop talking. just
Why
like-
they don't do this, I think that's stops them happen between you and the kids, the communication is not go through. I mean, they should tell you the reason why I choose this lunchbox, because the reason. Then the parents know, okay, you want to choose this lunchbox because of this, but they didn't tell you the reason, so you didn't know, and so that's the communication that didn't go through.
Mhm.
Right?
Ask why, like, why did you
Yeah.
choose that?
I think it
Why
all
is
comes,
important?
all come down to the family support.
Yeah.
Like, do you trust environments that is safe and secure and
100%.
supportive, and then if it's not established, then that's why they're not communicating.
If they don't feel safe disclosing critical information, then it's hard for you to intervene.
I think
Okay.
it might be better for parents to open up first, so you become vulnerable first, then you build that trust with
To model that behavior.
And then you talk to them like they're equal, not like your parents, not like their parents. So
Okay.
I think that
I got a question from the
Audience, Zoom
the
audience.
Zoom audience. So thank you so much for sharing. My son's 15, turning 16, and has experienced the anxiety attacks several times. He felt anxious, particularly when facing a presentation. He could not get out of bed on the presentation day. He felt
I felt that way sometimes.
okay. He felt instant stomach pain or hear something, then shake uncontrollably. He talked with teachers and counselor already, but he still got in this anxiety. He told me that he felt that everyone will laugh at him.
Irrational fears.
He
or
stands
maybe rational.
yeah, he stands 5'11" and well, pretty high, and weighs 140 pounds. Okay, so he participates in sports. What I try to say is that he appears normal physically. It is a big challenge now, as he has at least one presentation in school every week. He has called in sick 7 times since his term started. Really appreciate your suggestions or any resources we can approach. Thank you.
So when I came across instances like that, I use behavioral strategies and techniques to help them deal with their anxiety. So that may be first starting with imagining themselves doing that in a quiet room where they're relaxed and they get comfortable with being able to just in their mind imagine they're giving a speech and they can remain comfortable. Then it may be doing a presentation, sitting down with just you or by themselves recording it. So you have to use progressive kinds of strategies with that. You can't do an implosion type of thing. You just throw them in the middle and have them get over it. You have to build that behavioral success, that behavioral tolerance. And sometimes it takes a bit of time. I worked with a number of people that were suffering from post-traumatic stress disorder. And we had to use that kind of a strategy for them to be able to go back to the workplace, to be able to get out of the house. So you pair calmness, teach them relaxation strategies, breathing strategies, and now they know how to calm themselves. And then you slowly pair that with more intensive kinds of experiences that closely approximate the real thing.
Yeah.
And that's not something that you can do overnight. It takes time to be able to do that, particularly since they've already developed these negative behavioral responses. Yes.
So, would you say that this is a typical case where families should consider using counseling to help children to move towards the result they want?
I would say that that would be the way that I would deal with it, is we first to a therapist who's trained in behavioral techniques. Systematic desensitization types of strategies will help deal with that. You know, some people go to see a medical provider and they're prescribed anti-anxiety drugs. And that may help, but there's some side effects with that. And then there's some problems when they attempt to get off of those medications.
Am I talking too much? But I felt like I'm compelled to talk. If nobody's gonna answer question.
Well, if there are other, let's see if there's other questions.
Sure.
I do have another question.
Yeah.
We talked about the signs and symptoms. Well, you know that teenagers and young adults, they usually have strong behavioral changes as they enter into the stage. It's so different than how they were, when they were young. Then we already feel, probably parents, most parents feel that, wow, there's a huge change.
Oh, that's just them growing up. They're just becoming teenagers. It's the hormones. And it may be some of those changes, but you have to look at the degree of the change and the pattern of the changes in behaviors. You know, certainly teenagers tend to want to sleep in the morning. They don't want to get up and go to school, but they're up late at night till 2 a.m. talking to people on their phone or on the internet or whatever. So some of that is normal behavior and some of it isn't. And so being able to discern what those might be, and it's a pattern, not necessarily just one thing. Other questions or comments? Yes.
In the behavior change, before the suicide.
Yeah.
You mentioned that retreat, from the family or, social activities.
Right, they socially isolate themselves.
That's the twist. Does playing computer games still, a sign of being interested in activities?
It might be. It depends on why they're doing it, how often they're doing it, what they're doing when they are online. It may be that they're just going to one chat room on the internet and talking with peers.
Okay.
Or it may be that they're avoiding dealing with their emotional crisis by repeatedly playing games on the computer. You have to find out and sort of be an investigator, if you will, of why they're spending so much time and why that behavior has changed.
But they're just addicted to computer games.
And that's a whole different
That's
issue.
not the science.
That could be just there's an addiction, you know,
Okay.
and so sometimes you have to treat that addiction in other ways. And then if you treat that addiction and you see other behaviors, then you have to deal with the other set of behaviors.
Okay.
It's not uncommon. Obviously, everybody knows it's not uncommon for kids and even adults to get addicted to playing games on
So
their phone or on their computer.
can I conclude that being addictive to something is a sign of not going to suicide?
No, I mean.
No, I don't think so.
Maybe it's a challenge just for them to escape, like,
Right.
it's like drugs, instead of doing drugs, they play video games.
Yeah,
Instead of
but
drinking
I mean,
alcohol,
that
they play video games.
activity
So that's probably
maybe
better than doing
indicated they're
drugs.
not going to suicide, at least they are.
Right, but at some point you want to be able to influence them to develop positive kinds of behavioral responses as opposed to playing video games or.
It's distraction,
Yeah.
distraction from suicide maybe.
Right, so sometimes it's appropriate to some degree, but if it gets to be where they don't go to school, they don't do anything, they're always on the computer playing a particular game. Is it creating dysfunction in their lives? Yes, sir.
Oh, sorry, I was just gonna comment on something, so like,
Go ahead.
life is stressful, everyone has stress, so we all have a channel to vent the stress. So it might be like a hiking, it might be like watching TV, it might be karaoke, it might be playing video games, so like everyone's a little bit different, so maybe have a conversation with like the whole family and just go take a family vacation. I think that's probably gonna alleviate a lot of maybe a lot of problems with.
It may be an opportunity to further see what's going on.
Yeah.
Trying to get
100%.
them away from their addiction, if you will,
One
to another area. Yes, Evan?
Yeah.
Question, how to help kids with our kids faced with the racism in the school? So.
Faced with what, I'm sorry?
Racism.
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 So my kids sometimes okay, so different culture, sometimes I bring the food lunch for them. It's a Chinese food.
Right.
Yeah, but other kids said yaki or something. Yeah. You're yucky.
No, that's not the distribution.
So I think part of that is going to the school and asking the school to provide some sort of education to the student body. That they understand that this kind of behavior is considered racism and they shouldn't be engaging in that. That may be difficult to do. It may be that on an individual basis, you can talk with your son or daughter and explain to them the circumstances and ways of dealing with responding to those kinds of behaviors so that they build up some resilience. But it's better if you can stop that behavior rather than adapt to it.
It's not so it's like a friends, it's not she is not really always against you, but it's kind of like friend, but just normal communications that she's show some okay, I don't understand why you do this because of China. So my daughter sometimes she don't want me to say something to the teacher or to her friends, stop saying that, but still bother her,
Right, and so if she needs to feel comfortable in her own skin of confronting that situation, of saying to that person, that really hurts when you say that, I wish you wouldn't do that. Personalizing, maybe that colleague, that friend, that schoolmate will take that to heart and stop doing it. Yes, sir.
Because the same audience about the presentation boy. So he has a question. So also for the suicidal thoughts, he said to us that he'd rather die than doing presentation. It freaks us out. Do we need to bring him to see a psychiatrist or to get to momentary venting?
So if he's making those kind of statements, I'd rather die than do another presentation. Personally, I've felt that way sometimes. But it's anxiety and it's irrational anxiety. And so you have to deal with the anxiety. The child is just expressing that as a way of saying, I'm really serious about this. It makes me very uncomfortable. So I don't necessarily see it as a sign of potential suicide. I see it as a sign of, I don't want to do this because it's too scary for me. And I need some help to address or deal with that issue.
Okay, thank you. So we are gonna close at 5:15. So just have a few minutes.
Yeah, a
please.
couple more minutes.
Yeah,
left.
but we need a couple more minutes to clean up the page, the slide.
Answer the question.
All right.
I think it's a valid question because
Yeah.
I have very few Asian, Camas High School was 10%, and their high cap magnet and 30% Asian. I mean, better, but still you have to, even you tell your kids say, oh, tell your teacher if they bully you, but deep down, they still are afraid of losing this friend with this discrimination. So what I do is I try to establish relationship with their parents always. So as if you have your and have a potential friend, I always try to establish relationship with the parents and get to know them at a human being level, because humanity is universal, right? And also try to introduce my culture to them. Like my son just had a sleepover and I got something from Echma today. So I went, give them the Echma candy as a gift and tell them, oh, you can go to Echma to get those. And that that parents happened to be in South Korea vacation last year. So we immediately hit it off honestly. So sometimes, I mean, we have to do those things proactively instead of just like, you cannot demand respect. You have to earn your respect. And that's my point for people.
So that may be a strategy that some people want to try. I think working with the individual that is experiencing the distress and giving them the tools to manage that is the most helpful thing long life. You know, I could certainly intervene with a schoolmate's family to help them become friends, if you will. But I prefer to work with the person in distress, teaching them coping strategies, improving their psychological resilience.
Okay.
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 So thank you very much.
Thank you very
for
much,
listening to me. I hope
all of you
this
to
brief
come
overview was
come
helpful.
here today, and I think that's all for Mike. Thank you, Mike.
Yeah, no problem.
Yeah.
Your presentation is great.
Oh.
And very well organized.
I-